Our next speaker, who is fresh in from China, I believe, is Barry Popkin, who is the W.R. Kennan Distinguished Professor of Nutrition and Professor of Nutrition Epidemiology at the University of North Carolina, Chapel Hill. He's been actively involved in caloric sweetener, beverage, and related research in the United States and globally for at least 2 decades. Dr. Popkin has been a member of Mexican and Chinese government panels involved in beverage use guidance and regulations. Most recently, for the Mexican Ministry of Health and the FDA, he chaired a panel of scholars creating a front-of-the-package food labeling system for Mexico. Barry is one of the most cited nutrition scholars in the world and is the author of the book, The World is Fat, translated into 9 languages. We're very privileged and delighted that you could make it, Barry, and please go ahead. Thank you.
Hi. Well, needless to say, I'm glad I'm here, and I really wish I had been here yesterday. I want to talk about a number of things that will try to add to discussions yesterday where I can fill in a few issues that weren't covered. Most of my talk will be global. It will be short because we have a lot on the agenda, but I want to cover a few points related to the U.S. and before getting into some of the global issues. And I want to remind us of what's gone on in our world. And I want to remind us that for hundreds of thousands of years we drank water. It's only really been in the last 10,000 years that we drank any caloric beverage. And really only in the last 50 years that caloric beverages represented in the history of humankind anything more than 10, 20, 30 calories a day. So we've really changed. This shift obviously relates to taste. And as we all know from that infant picture, classic infant pictures of the infant who got the sweet taste, we love sweetness. Very trivial percentage of the population doesn't have a preference for sweetness. It is just part of who we are, and the food industry, it would be stupid not to have taken advantage of it the way they have. And it's up to us, as we all know, to go forward. The second thing I want to remind you that wasn't brought up yesterday is, but we have talked about often, is the disconnect between what we eat and how we drink. And you all know that if you don't drink for 3 to 7 days, you'll die. But you can not eat for 2 months and before you'll die. And the difference that happened through the millennia as we were hunter-gatherers, as we had seasonal food, but we needed to drink every day, did something to somehow change how we eat and drink. And what that essentially is this one classic study from Rick Mattis, whether you're drinking on the left watermelon water, a carbohydrate-rich water, versus eating watermelon, drinking coconut milk versus eating coconut meat, drinking regular milk versus cheese. In every case, if we put our day's intake into that item, we increase our calories. We know we do not compensate when we drink anything with calories versus diet, waters, teas, etc., with very little sugar. And we have evolved. When I looked at the globe in the 1950s and 60s and 70s, we ate very little sugar in our diet. And we have changed so drastically, it's quite amazing. This is the U.S. food supply. This is everything that Americans purchase in consumer packaged goods. 600,000 different foods and beverages we buy in our supermarkets today. On the top yellow line on the left, you will see a trivial change, but essentially 75 to 80% of every food and drink we consume has sugar added to it, caloric sugar. It's there in every product. On the right are the non-nutritive sweeteners, and the volume says about 15% of everything we eat also has those added. So sweetening of the world, our diet, sweetening of the diet, every place in the globe has been one change that has happened in the last 30 years, a major shift that has gone on in the food industry. Obviously, with beverages, it's more critical. And I want to point out here, and I really can't, it's hard with the two slides. I want to just look here. I want to point out one thing. In the left is fruit juice concentrate. Now, I want you to understand that fruit juice concentrate is not covered in the U.S. sugar quota, and it has become the new sugar. It is increasingly being used, partly because the Chinese are producing billions of tons of apple juice concentrate they're selling on the world, but partly because it's not covered in our quota. So when you hear about the USDA governing sugar and trying to limit it and the prices going up, it has nothing to do with the new sugar, which is natural, fruit juice concentrate. So you'll notice on the left for sugar-sweetened beverages, now about a third of them contain fruit juice concentrate. You'll notice even formula and other things do. It is increasingly coming in our diet as kind of quote-unquote the natural sugar. So be wary of that. I want to briefly mention, we did something quite different than what will come out soon from our group and from David Ludwig's group, all of whom did random controlled trials on beverages. We did one in Mexico that will come out in the fall or next winter. David has one that will come out soon on adolescents. And this is one that was quite different. It was a random controlled trial where everybody was trying to lose weight. And so a lot of our controls even shifted to healthier beverages unbeknownst. But we gave water to one group, diet to another group, and the third 100 adults kept with their normal diet. Right when the recession hit and caloric beverages went way down in North Carolina, we still got a much larger weight loss among those who consumed the diet or the water, and in the water group in particular increased its hydration status and reduced its blood pressure and had some other kind of effects that are very suggestive, although we hadn't powered it really to test water versus diet beverages. It was really a study to look at the effects of getting rid of sugar-sweetened beverages by replacing them. The point is that we can do it. We have more science coming on the random control trials to figure out that one little gap that some of the scientists out there say is we don't have. But that's not the point. We know what's going on. Now, I want to shift to talk a little bit globally. And in the midst of talking globally, I want to talk to you about some of the things going on. Unlike tobacco, the U.S. is behind the rest of the world. Okay, you know that we're banning, quote unquote, in the elementary schools, soft drinks and a few things. There are 20 countries that have banned soft drinks in all schools. There are 6 countries that have also added fruit juice banning. The world is changing, and we're kind of behind the gun now trying to catch up. It's very different than the tobacco world. And it's partly because these countries are desperate. Their levels of obesity, their levels of diabetes equal ours in many cases. It certainly is the case of Mexico, and Brazil all of a sudden went up from 20 to 40, 50% overweight and obese. Chile went up. China, a third of adults are obese. There are more diabetic Chinese children in a paper we have coming out soon than there are U.S. children, based in comparing Haines data, hemoglobin A1C, versus U.S. data. The fact is all these countries around the world are desperate to deal with the problem, and they're moving on it in many cases much faster than us because the healthcare costs and the cost in human development, they've recognized them. And I want to show you a few other things you can learn from the strategies that have been playing there, because strategies that I've faced over the last 3 years in Mexico, for example, in China, all of a sudden were coming here, one of which is the breastfeeding strategy. Okay, they're saying obesity is going down, sugar-sweetened beverages are going down, therefore we're not the problem. Well, that's what people said about infant formula, where they said breastfeeding was going down, infant mortality was going down, so therefore breast milk didn't matter. We've got to remember that a lot of these arguments have been used and reused. They've been used in tobacco, they've been used back in the old infant formula battles when we were trying to promote breastfeeding, and we've been seeing them, and now we're starting to see them in the US. If you just look today on the new American Beverage Association site, you'll see they use that ecological fallacy argument, that if obesity is going down and sugar-sweetened beverages are going down a little, it matters. So it's been happening. They've been using that all over the world. But let's look at the opposite. Let's look. There are different scales, but this is China, how it's increasing. When I went to China in 1989 and did our first national survey there, we had 2 grams of sugar consumed per capita. China has a sugar reserve today. They're consuming sugar up toward our level. All, thanks to partly to the beverages, a big hunk to the beverages, much more than you can imagine. What are the Chinese doing about it? So there they've had national plans. Actually, in a number of my provinces already that we work with the CDC in China and with the Chinese provinces, they've actually done a lot of things, but they haven't done a tax anyplace yet. But in 2 to 3 years, there'll be some really strict regulations in the schools and government buildings and other stuff. It just takes a long time for it to happen. But the point is that it's one of the countries that when it does it, it will do it. It just takes very slow and plodding and going through. Now here's Brazil. Here's again the same situation. All of a sudden, in the last 4 to 6 years, across the globe, Coke, Pepsi, Schweppes, the local clones, and there are many, many of them. It's not just Coke and Pepsi's fault. It's sugar-sweetened beverages in general. They have really upped the level, the ante. In China in 2004, I had in none of my schools vending machines. Today, every school had it. That's why we're starting to get rid of it in some of the provinces already, and they're moving on it. The fact is, everything that's been done here or done there, they're using back and forth. And I'll show you that in a second in a very interesting way. Now, this slide, the bottom is the thing that they're talking about a lot. Calories per ounce. You can't see it very well, I don't think. Calories per ounce in the US from both Coke and Pepsi sales have gone down. The fact is they are getting us to buy more diet, more water, more low-calorie beverages. They're doing it here and they're doing it in Europe because we've been pushing and yelling so loud. But obviously the decline is trivial compared to the health costs of what remains, and we know that. But in the rest of the world, you don't see those changes. In China and Brazil, you see a level calories per ounce. This is a US-Europe push. But there's some other pushes I want to show you in a second after I go through Mexico. Now, Mexico is unique, and we are facing the same problem because Mexican Americans in this country are huge sugar consumers, and they're huge sugary beverage consumers, and it's in everything they do. Well, Mexico is facing a diabetes problem that with the national survey we just did right now, I expect will be higher than ours. And when I look at the diet data, I expect I'm going to show you up to 2006 how their beverage changes occurred. It's going to have really gone up again, I'm afraid. But what did Mexico do about it? They created a beverage panel. The government did. They got beverages out of the schools. A huge battle. God, there were more websites fighting us. There were more. I can't tell you how many journalists were given money that we've talked to put in all sorts of articles raising questions about beverages. This is, the battle went on there just like here. But Mexico started on it. But the next battle that Mexico's doing, and Chile just passed it yesterday and today, is a front-of-the-label packaging which will say water's healthy, diet beverages are okay, the others are poison. The juices and the soft drinks are poison. Chile passed it, Mexico, the legislation's running through the FDA. So the fact is, some of these countries are really moving hard against some of these issues. Front-of-the-label packaging, which our Institute of Medicine came through with a very strong set of arguments to come up with something simple that tells us this is a healthy food or not. It's a healthy food. They're not going to put the red light that says this is an unhealthy food. But we're hoping that if we have this Obama administration again, that Margaret Hamburg and FDA will push that through. It is one of the battles going on globally because the food industry doesn't want us to start labeling their products as unhealthy or not labeling them as healthy. And so that front of the label packaging, front of the label profiling, and getting rid of everything else that says, oh, this juice makes you do this or that or gives you more brain power. All of that will be gone in these countries when these front-of-the-label things come through. That is half the battle, because what goes on in the store is a piece of the game. Now, here's Mexico. I don't want to go, I'm going to go very quickly. Mexican kids, Mexican adults, they all doubled just between 1999 and 2006, up to around 20% of the calories from beverages. That's what happened in Mexico. Now I want to show you one interesting thing. This is across a bunch of countries, 7 different European countries, large studies of several 24-hour recalls of adolescents. I want to show you in the next slide, the second bar is chocolate milk. Then it's soft drinks, then it's fruit juice, depending on the country. But every country, all of a sudden, chocolate milk went up. They started pushing it in these countries. And juice went up to replace sugar-sweetened beverages. So that's why we have to be careful, that they have a whole array of products. Now I want to show you in the US. Look at chocolate milk in yellow. Look at how it went up in the US between these different time periods in our school-age kids. It happened in Europe and the US at the identical time. The point being, the array of weapons they have to sell as sugar are vary a lot. And we've got to be battling against sugar in a very broad way in beverages. Okay, next thing. Just talking very briefly about some of the pushes that we're seeing around the globe. They're not different than we're seeing here. We're seeing the same attempts, except in some of the low-income countries, they go door to door, and they give them samples, and they give them coupons because they can afford very cheap labor. And they're breaking into market after market, and all of a sudden, you're having not a single country in the world where you don't have at least 10 to 50 calories a day of sugar-sweetened beverages now. It's really quite amazing how it's shifted globally that way. But I want to point out one thing that wasn't discussed yesterday, and that's why I wanted was juices. We have to remember we don't have as many studies on juices, but the long-term studies we have, a study of 100,000 from Singapore, followed over a decade, the juice drinkers quadrupled their risk of diabetes. Studies in Australia on weight gain, studies in Spain on diabetes and weight gain, studies in the US when they're done right and independent of industry influence, and they're longitudinal or otherwise. Fruit juice really is no different than soft drinks. It's another sugary beverage. It's going to be a harder one for us to deal with, and that's why only 6 countries have banned it so far, and we're trying it at several other countries in Europe right now to ban it because it's looked at as healthy. It was kind of an apple a day, and it got translated into apple juice a day. Well, apple juice is not an apple, and you know that juice, that glass of juice is not the same filler and the same health benefit as those 4 oranges or 6 oranges. So the reality is that's going to be one of the next frontiers that we're going to be facing globally. I'm seeing it already in a number of countries. The marketing going up for juices, and it's something we have to start to be aware of. It's going to take us a long time to move from just talking sugar-sweetened beverages to juices, but we're going to have to do it ultimately. In Australia, they had a big battle on soft drinks long ago. Juices. They got fat on juices, their kids. Their kids were fatter than ours 8 years ago. So the reality is, it's not just, in the end, it's going to be all these sugary beverages, and we have to be careful. The other thing that I'm seeing and you've seen is global philanthropy. And they asked me very briefly to bring it up. And one of the most interesting things that I've seen in the last decade, it started first in Australia, where Coke had all these signs. Be hydrated, be active, drink Coke. And now you'll notice in international meetings across the globe, Coke has sessions on hydration. They don't say water hydrates you better. They don't talk about water. They talk about just hydration in general and how you need to keep drinking all the time. And that is one of their new pushes that they've started in a lot of countries. And it's a very aggressive piece that they're doing in a number of the countries that I deal with. Otherwise, all the kinds of events, product placements, everything going on that we see in this country, it's going on everywhere. A little more unruly than here because we actually, in Europe, even more than the US, and then in the US there's some controls. Lastly is media control. We haven't touched it here, we've tried, but Brazil has a marketing law that will hopefully come through this year. A number of Europeans have them. They're being considered in half a dozen other countries. And it's total up to 10 p.m. Anything on TV that has sugary beverages or other kinds of junk food. It's not this little selective kinds of pieces of the game that we have. If a kid's going to watch it and you pick out kids' programs. So we can learn from the rest of the world. We also can learn from how Coke has dealt with us over the decades. These kinds of things. You know, we've seen these time and again in other countries versus the Chinese pushing water and, you know, which is really where we all want to go. Diet, low sugar, tea, coffee, drinks, beverages, water, and possibly diet beverages. And diet beverages, as I know you've all talked about, is a real complex issue. We really don't know what it does to us in terms of sweetener preference, which is really, to me, the critical issue. And lots of us are studying it to try to understand if diet sweeteners will really have any adverse effects. We know in the US we have two kinds of consumers, diet sweetener and Big Mac kind of consumers, and diet beverage and healthy consumers, and diabetics and so on. So we have to be careful how we deal with the diet issue now because of the diabetic concern and the huge population there, and also because there's a lot of lack of knowledge of that yet. It's still the unexplored terrain out there. And I'll end there. Thank you. Of course.
Any questions for Barry? Over there? Could you wait for the microphone, please, so we can get it on?
Nancy Hunergarth, and I'm the Executive Director of the New York State Healthy Eating and Physical Activity Alliance. And I just wanted you to give more thoughts on what I find is sometimes the elephant in the room, which is that so many health organizations tend to accept funding from the beverage companies, McDonald's, et cetera, even while they're simultaneously working on policies that, you know, improve health. So I wanted more thought on that and wonder if the entire community should be rallied around that issue.
Right. It's clearly one that a lot of us have faced. On the one hand, if the American Diabetes Association is concerned with sugar, then they won't endorse sugar products, but they'll endorse high-fat products. And if the American Heart Association has been historically concerned with the fat issue, then for a long time they ignored the sugar issue. And if you go to the American Dietetic Association, or however they're rebranding themselves, they're not concerned with anything except money. And if you look at their statements, you'll see really, they have refused to take on sugary beverages at all, even with their last statement. And the fact is, this goes across dozens of organizations, many created by the beverage industry and the big sugar to kind of act as cover. So it's a big issue because you go to them. Every time they quote a Kelly or David Ludwig or any number of people, then they'll go to the Journal of the American Dietetic Association for their official answer, speaking for dietitians in America. And of course, what will be their response? And it happened for all the major health organizations at one point. Hopefully today, everybody, all the heart associations, all the diabetes associations, many of the major kidney and other are all behind the sugar-sweetened beverage ban. We got to get them on the sugar ban as well. When it comes to juice, we've got to get them thinking about all the beverages with sugar in them. But the reality is they've changed by public pressure. The American Dietetic Association is kind of one of the groups that has not budged 1 inch because they get so much money from every food company. It's crazy. But other than them, and we have to keep harping on that and somehow in the public eye make them be seen as kind of the weapon of the industry. That's the only way we can deal with it when these blogs and the public comments come out and so forth. And you're absolutely right. It has been one of the insidious ways that worked itself through in the breastfeeding world when we were fighting for breastfeeding, in the tobacco world, and it's come full scale into the whole sugary beverage world, into the whole junk food, empty calorie world, and into the whole diet world in a very big way.
First, thank you so much for your wonderful speech. I must say I'm not as optimistic as you are with regard to Brazil and China. Coke and Pepsi, Coke alone is investing $4 billion a year in bottling plants and other marketing in China, India, Brazil, and Mexico, leaving aside all of Africa and much of the rest of Asia, like Indonesia. And then they have their delivery machine, fast food restaurants, beginning to set a new norm. KFC in China, you know, is every street corner, and McDonald's is playing catch-up, and soda pop is the beverage. So, and it's sad to see the ministries of health just saying, come on in, invest your billions of dollars. But I wanted to say one other thing, which is uncharacteristic of me. The American Dietetic Association, I think, is really changing, and not just their name. The ADA has been a really strong supporter of things like menu labeling and getting junk foods out of schools. They've been a supporter on Food Day. So they still may take, I don't know, I haven't kept track of where they get money from, but I think there's a new day and a welcome evolution of the ADA, maybe behind the Heart Association, but still really good movement in the right direction.
Okay, let me make a couple comments on both of those. Absolutely, you're correct. India and China, Brazil, mega countries, Mexico, these are countries with 100 million to 1.5 million people, are clearly the target for these countries, and they're really pushing hard. But what I have found in some of the provinces in China, which are about the equivalent of half of the US, they're actually changing, and they're actually doing some things. And now we're working with the governor in one of the provinces that may actually put in a tax. I'm not sure if it will happen and it will be punitive enough to be really worth it, but the point is that the health costs have hit them so hard, so quickly, and they're ill-equipped to deal with it. So some of them are starting to try to move on this. Clearly, Brazil has not moved on sugary beverages at all at this point. The marketing law that's going through is the first step. They have in the schools. You can't see anything in the schools other than water and reduced fat milk. But aside from that, they haven't. In India, 2 years ago, I wrote a speech with Srinath Reddy for the Ministry of Health that said that the minister gave a talk about banning soft drinks in the country. The next day, he was destroyed in the media. And for the weeks thereafter, the Beverage Association and all their clones and all the funding did exactly what you're saying. In India right now, I don't know, we don't have a chance. Right now, it is exploding. It's one of the highest sugar consumers in the world, and you're absolutely correct. I did not talk about it, and it is, right now, it's been impossible for us to do any regulatory work. This front-of-the-package labeling approach I talked about is starting to be thought of as an option in India, both by their FDA and their Ministry of Health, and it may be a backdoor to do a little bit of this, but it's a huge battle we're talking about in the third world. That is where all the sales increases are coming. That's where all the profits are coming, and you're absolutely correct, Michael. This is a big battle. It's being replayed. I can't tell you all that they did in Mexico when we did our beverage guidelines and the battles we had to get the school regulations in. We did. They were meeting daily with, especially Pepsi and Coke, but also Kraft and everybody that had anything to do with foods that went into the schools in one way or the other. And yes, this is not an easy fight. And the same fight that we're talking about here is going on everywhere. And that's why I was really pleased when I got this Chilean stuff in Spanish and I had somebody explain exactly, fully what it was, because I didn't understand some of the subtleties, that they really are one last procedural vote away from putting in a kind of a red light or a green light approach for this. And when I looked at it, it would put a red light on all the sugary beverages I talked about and a green light for the waters and diets and the other kind of healthier beverages. So, you know, the cost to those countries are far greater than the costs in this country. We have a much higher GNP per capita. We have somehow been able to deal with or ignore the diabetes, but these other countries are afraid. Mexico is really scared about the diabetes epidemic there because they can't handle it.
Unfortunately, as much as we would love to continue on with this discussion, we have to get to the working groups. So I'm going to thank Barry, if we can all give him a hand.